Week 11 is patient care, and again, week 11 follows the ARRT content specifications. Here they are, ARRT content specifications. This is section B, patient care, and then it goes into a big long list of things. And so that's what week 11 just follows, this long list. And so it's kind of long. A lot of this you already know, but it's worth repeating and talking about. So first is patient communication. Of course, communication is of utmost importance, cannot be overemphasized. You must communicate with the patient before, during, and after the procedure. When you see the word consent, just automatically add the word informed consent, because all consent is informed consent. You have to inform the patient. Again, communication cannot be stressed enough. Informed consent. So that means, of course, permission from the patient. All consent is informed consent. Then there are 3 types of informed consent. Implied. So that would be, your unconscious patient that comes in. We're there to do no harm. We're there to help the patient. That's just implied. Then you have verbal consent. Now that would be more like, think back to like your chest x-ray days, when you are describing to the patient, what you're going to do, and then describing to the patient what to do, and they just kind of go along with and follow your directions. That would be verbal consent, because remember, a chest x-ray doesn't need a form to be signed or anything like that. So that would be verbal consent. And then written consent. The written consent is where there is greater than usual risk. So basically, whenever there's a needle involved, that requires written consent. So of course, any cardiac cath requires written informed consent. Also, anything that involves a needle. So like any of your CT scans, like with contrast, anytime you introduce contrast, you would need written consent. Okay, post-op instructions. Of course, this is going to vary from place to place and what kind of closure device you use, things like that, but just need to think about it. Remember that if it's femoral access, that affected leg is straight and non-weight bearing for 2 to 6 hours. Radial access, limited use. Here's the main thing. Just stay alert and be aware of any changes in condition. So pain, swelling, numbness, appearance, things like that. Okay, vital signs, there are 4 of them: temperature, heart rate, respirations, and blood pressure. So temperature, the normal is 98.6, rectal is 1 degree higher, axillary 1 degree lower. Then there's some other terms in here, fever, hypothermia, things like that. Heart rate, normal is 60 to 100. Remember these terms. Below 60 is bradycardia, over 100 is tachycardia. Respirations, the average is 15, so anywhere in the range of 12 to 20, 15. Cyanosis is when the patient has a bluish appearance. Then blood pressure, again, your general normal is 120 over 80. Remember what systole and diastole, top number, bottom number, and measured in millimeters of mercury. So all of that is important. Access assessment. So access is a big deal. Of course, we can't do our procedures unless we have access. Usually an artery, sometimes a vein. Okay, peripheral pulses. Okay, so first of all, let's talk about what a pulse is. The pulse of a person represents the contraction of the heart. When the heart contracts, it pushes blood through the arteries. The force of the blood running through the artery is what we feel and is the pulse. And then here are the anatomical locations where we can feel the pulse. So this is places in the body where the artery becomes a little bit more superficial, meaning more towards the surface, and it usually crosses a bony landmark, and that is why we are able to feel it. So of course the brachial artery is in the elbow area. We can feel the radial artery in the wrist area, femoral artery in the groin area, popliteal behind the knee, Posterior tib is on the lateral aspect of the ankle. Dorsalis pedis is on the dorsal aspect of the foot. Pulses can be graded, scale of 0 to 4. 0 would be no palpable pulse, so maybe it was Dopplered. 1, faint but detectable, and then you got all the way up to 4, which is bounding. You want to feel the pulse with your second and third digits. Do not use your thumb because the thumb has its own pulse and you may confuse it with the patient. Evaluating the pulse must be done before and after a cath lab procedure. Before the procedure tells you what is normal or baseline, and after tells you if it has changed since the procedure. Feeling pulses takes practice. And remember, veins do not have a pulse. Arteries are the only ones that have a pulse. Okay, so the lab. So the lab is a department that we X-ray techs aren't real familiar with, but in a cath lab we do become more familiar with these types of things. And basically our body fluids, sweat, blood, saliva, urine, feces, sputum, those fluids have lots of things in them, and so these things can only be detected under a microscope in the lab. Looking at these things can tell us a lot about our body. In this lecture I will talk about these things, describe the common blood tests, and talk about how this affects our job as cath lab professional. Okay, so first of all we need to know that what blood is made of. Blood is a liquid made up of two things, blood cells and plasma. So just think plasma is just your water, is the solvent, and then it has, this plasma does have some other things like dissolved in it, the solutes, but just think of plasma as the water, and then it has blood cells in it. So blood is made up of water with blood cells floating around in it. There's 3 types of blood cells. There's the red blood cells, the white blood cells, and the platelets. So first we have the blood chemistry test. This is also known as the Chem7 or metabolic panel. This is a test that looks at all of those different things that are in our blood. And so here are some of those things, such as glucose, BUN, creatinine, electrolytes, and enzymes. So first is glucose. So another name for glucose is sugar. So if there is an elevated level of glucose in the blood, then the patient has diabetes. BUN, blood urea nitrogen. This tells us if the kidneys are working or not. The kidneys filter blood. That is, it separates the waste from the blood. It cleans out urea and nitrogen from the blood, or it's supposed to. And then once it does, it's supposed to send it out of the body via our urine. If there is an increased level of BUN, then that means that the kidneys are not working properly. They are not filtering out the urea and nitrogen from the blood like it's supposed to. So if it's not filtering out urea and nitrogen like it's supposed to, then it's not going to filter out the contrast that we're getting ready to inject into the patient. So that's why these BUN and creatinine and GFR tests are so important to know if the kidneys are filtering like they should. If they're not filtering, then they are said to be failing or in renal failure. So again, creatinine is also tells us about function of the kidneys. It's the same concept as BUN. If there's an elevated creatinine, that means that the kidneys are not filtering out the creatinine like it should. So the kidneys are failing. And then there's electrolytes. There are several electrolytes in our blood. Some of the common ones are sodium, potassium, and chloride. All of them have different functions. What do we need to know? That all of them must be within normal limits in order for our body to function normally. So they just need to be within normal limits. Moving on to enzymes. So these enzymes are more things inside the cells of our organs. If a particular organ is injured, these enzymes leak out of the cells and into the blood. There are thousands of enzymes in the body. The ones that we carry about is called creatine kinase, the more commonly known as CK or CPK, or the cardiac enzyme. If there is an increased level of CK in the blood, it means that the heart has been injured, like for example a heart attack. And so CK has leaked out of the cells of the heart and into the bloodstream. So that's a blood test that is important to us. And there's also a protein, so not necessarily an enzyme, but sometimes we call it an enzyme, but it's actually a protein called troponin, and it is analyzed in the same way. So just like CK, if there is an increase in troponin in the blood, it means that the heart has been injured and troponin has leaked out of the organ or heart and into the bloodstream.